As we begin a new work week with substantial changes to our regular conditions of work and daily lives, I wanted to be in touch with our medical school community, all of you, about these most challenging and uncertain times. To begin, please know how privileged I feel to be part of this special academic community. Your commitment, compassion, engagement, support, and understanding have been both heartening and moving to observe. Your collective efforts are helping our institution to lead from the front, and your continued contributions will be of paramount importance in the coming days, weeks, and months. This marks the start of a new paradigm to the way we work, interact, and advance our mission areas. Distance learning and remote working is the new normal, as abnormal as that may seem. And instituting these rather sudden changes requires the cooperation, collaboration, and collegiality of each and every one of us. Our learners are now receiving instruction from and interacting with their faculty and fellow classmates in virtual settings. Those engaged in bench research and working in our laboratories are ramping down their wet lab research activities and preserving essential functions and resources. The bulk of our managerial and administrative workforce is continuing their core responsibilities, albeit in remote locations. Our colleagues working at Mass Biologics and Commonwealth Medicine are in the process of implementing operational plans aimed at maintaining the essential services, programs, and products they provide to those in the state and around the world. Those who are responsible for the operation of clinical facilities or the provision of patient care continue to see to their responsibilities despite the heightened risks. Clearly, it's a time of unprecedented uncertainty. I've been thinking about how special our medical school community continues to be. You see, ours is a high calling, and our hallmark is a collaborative spirit that defines and distinguishes us. There's a goodness in those who are our colleagues. As we face this new era and find ways to work remotely together, let us remember that some of our colleagues will need to report to work to perform functions that are critical for the ongoing operation of our medical school. Please join me in letting them know of our appreciation for their selfless efforts. For others, let us find a new creativity together. As we're away from our usual workplaces, let's not forget about each other. It's my hope that we shall keep in constant contact with each other and recognize that some will be lonely, a bit afraid, or perhaps even distant, as social isolation is not our norm. 2, we must be cognizant of the many members of the community who may fall into one of the high-risk categories or who will need to be present to their children or other dependents. Yet together, as we act to stem the spread of COVID-19, our isolation must not come between us. I shall look forward to hearing the creative ways that departments stay in touch, how colleagues further their work efforts, and how we reach out to those in our midst who are most in need. Be assured that we will continue our efforts to communicate regularly. On Tuesday, March 17th, I plan to hold one or more virtual town hall meetings for any interested community members who wish to pose questions or share perspectives directly with me. Additional instructions regarding how to join a virtual town hall session are forthcoming. For those of you who plan on participating, I would like to hear your thoughts on how we might serve each other and support our local communities. Already, I've been in contact with Worcester City Manager Ed Augustus and Massachusetts Governor Charlie Baker to convey our willingness to help during this period. I'd like to assure you that our medical school is strong, and it will make it through this temporary, remote existence. And when we come back together, we shall be stronger than ever as we continue our efforts to change the course of history of disease while learning, teaching, discovering, and caring together. Well, I'll be in a mostly empty office during the upcoming week. I always can be reached via michael.collins@umassmed.edu. I encourage you to reach out to me directly if you need to ask timely questions or share important thoughts. Ours is such a special medical school. Let us make it even more so in the weeks ahead as we care for and about each other.